welcome to our clinic. How are you feeling tonight? Well, always glad to see you. Right. Yep. You can take your seat right here in front of me. Do you feel comfortable enough? Okay. Maybe you'd like a glass of water. An extra cushion or blanket. Very good. Okay. Yeah, it's quite warm in here, so I suppose. But just in case, do let us know, okay? You can tell me, and I'll be able to fetch you whatever you need. That's right. Alright, so you're here for your cranial nerve exam, right? I see that. Alright, so tell me more. When was the last time you had your cranial nerve exam? When was the previous one? At least approximately from what you remember. Did you have it at our clinic? Okay. So do you remember what the result was? Did you have any issues back then? And what about now? Are you here just as a regular checkup? Or is there anything bothering you? Okay. That sounds interesting. Are you sure? Right. Okay, got it. Did you have any injuries before that? Yeah. Have you had any? Any accidents? Colds? Flu? Infections like that? Anything special? Anything you think I should know? Please do not hesitate to share. It's totally fine. In some cases, the patients might think that they would sound silly or that some information would be redundant or excessive, but in reality, in most cases, it's actually can be something really, really important that we might skip. So, we don't want that. So just in case you do remember something that might be of some use for us, do let me know. Anytime. Yeah. Right, well, I believe that we have all your personal data here in our system, so no need to confirm anything. Right. Okay, well, now let's skip to the cranial nerve examination itself. Are you ready? Alright, well, to start with, what do you know about the cranial nerves and how they function and everything related? Would you like me to tell you more about that? Okay. Of course, the pleasure is all mine. I'll show you some charts for you to see how it all functions in our brain. And here are some charts that we will use later to check your eyesight. There are quite many of them. We're gonna have a super thorough and detailed examination tonight. But no worries, you're not gonna be bored. It's all really exciting, and a lot of tests that we're gonna have are quite enjoyable, so our patients do love them, and you will enjoy them too, I can assure you. So please, no worries, try to relax, okay? Right. Well, so the cranial nerves and how they work and what they are responsible for. Yeah? Let's have a look. First, their cranial nerves would be olfactory. And as you might guess, they are responsible for your sense of smell. Yeah. So regarding that, have you had any issues? Anything, like, have you noticed anything strange about your sense of smell lately? Has it happened to you that you wouldn't be able to feel the smell, or maybe vice versa? Even you think that it smells of something, but in reality it doesn't, or other people are trying to reassure you that it doesn't? I know that it might happen, yeah, after certain kinds of viral infections. Yeah. So, for example, during pandemics, many people had very similar symptoms when they would confuse some smells, or when they would stop eating something just because it suddenly smelled really bad to them, or they didn't like the taste anymore, so their taste receptors would like change a little as well. So yeah, it can happen. And in some cases the problem might be your cranial nerves. In some cases it might be something else, something different. So that's why we are here, to test you really thoroughly. Alright, well, so we'll check your sense of smell a little bit later. Now, the second, but at least whatever we can see here, would be your optic nerve, which is actually responsible for your vision acuity. I mean, the word optic, yeah, can tell, apparently, but again, when it comes to vision acuity, we're gonna check that using the Snellen chart. You might have seen it before, and here's what it looks like. I have a few of them, different kinds and different colors and stuff, but in general they all serve the same purpose. Yeah, well, then next we have oculomotor nerves and trochlear nerves. Both of these pairs are responsible for your vision as well, but mostly for your eye movements. Yeah, either horizontal or vertical, from left to the right, from bottom to the to the top, and vice versa, right? Because it's extremely important for you to be able to move your eyes as well, and that we're gonna check too. You will trace some objects with your eyes and so on. Yep, exactly. Next, what we have here is trigeminal nerve, and it is mostly responsible for your face expressions, for your face movements, how you can like make different expressions with your face, like smile, frown, and so on. So I'll ask you to do all of these things a little bit later as well. Yeah, so here we have a short review of how the exam will proceed, how it will actually take place, what steps we're gonna take. I know that for many patients, especially those who are prone to anxiety and stuff, it is really important to know what is awaiting them. Yeah, so what's gonna happen next. So just to calm you down, to make you feel relaxed and safe. You're really safe with me now, really protected, so don't worry about anything. But just to make it a little bit easier for you, I'm gonna tell you every single thing. Yeah, I hope it's not too boring for you, is it? Wow, that's awesome. So, your face. Yeah, that's most about trigeminal nerve, but there is also facial nerve, and it is also like responsible for some of your facial expressions and partially for your sense of taste. But there are also other nerves responsible for your sense of taste. There are actually 3 of them that perform this function. So, besides that, we also have glossopharyngeal nerve and vagus nerve and hypoglossal. So when it comes to glossopharyngeal and vagus, they are also responsible for your sense of taste. Yeah, the same as facial nerve. And then hypoglossal is mostly about your tongue movements that we're also gonna check tonight. Wow, and finally we have abducens nerve, which is also responsible for your lateral eye movements. And we have auditory. It can be like called different ways. Sometimes you can also come across the name of like vestibulocochlear, but anyway, that would be mostly the same. So it's about your hearing, but since it's also related to your vestibular apparatus, it's also about your balance, sense of balance and coordination and stuff, right? And finally, like I said, vagus nerve is responsible not only for your sense of taste, but it also is related to your like peristaltics. Yeah, so vagus nerve is called this way because it's like really long, and it goes down to your organs like your heart, your stomach, and everything. So it's not only about your sense of taste. It's way more than that. An accessory nerve is mostly about your head and shoulder movements. You're gonna check them too, so you're gonna move quite a lot tonight. But I still want you to be relaxed as much as possible, because none of the instructions that I will give you are gonna be really challenging. So please, no worries about that, okay? Don't you worry, it's gonna be alright, okay? I'll show you a few more charts of how those nerves look like, how they are located in your brain, okay? Yeah. So again, here you can see all the same pairs of nerves, like I said, yeah? Here you can see them in different colors, and so you can see that these are actually like pairs of nerves, which are located around and stemming out of your brain. They move along your body, basically touching to different parts of your body and organs and stuff. Okay, let me think. Oh, okay. We also have another picture. Oops, I like the style. right? It looks just like some kind of drawing done by a medical student in their notes. Yeah, but basically here you can see all the same kind of stuff. And finally here, again, a very serious chart showing all the same that I have already told you, but again with the picture and some short like functions of your brain enumerated in here, so shouldn't be too hard. What do you say? It's really easy to understand. Well, but I'm always glad to explain everything, whatever you want to know, okay? So, throughout our exam, let's get the deal that you do not hesitate to ask any questions, alright? Whatever, like, no matter how silly they might sound to you, they will never sound this way to me, okay? Yeah, so... right. That's okay. Don't you worry. It's gonna be fine. Okay. Let me put on my latex gloves. I suppose that I might need them, especially if I'm gonna check up on your face a little. So I'm gonna touch your face really, really slightly. It's not gonna hurt. I promise. Okay, seems like I'm ready. So, let me have a closer look at your nose, mouth, and throat. Okay? We'll start with these parts, and we'll probably test your sense of smell and sense of taste right away. Okay? You don't mind. No worries. This is a disposable spatula. I'm gonna use it with you only, and I'm gonna throw it away right afterwards. So, would you be so kind to open your mouth really widely? Just for a moment. I will put the spatula inside your mouth, but I'll be very gentle. I'm not gonna press too hard on it, so please, no worries about that, okay? Good. Okay, say once again. Okay, now I will put the spatula in your mouth again. Could you please try to move your tongue in your mouth like that, and to the side. And one more time. Now I'll take it out, and could you please reach the inner side, the inner part of your cheek with the tip of your tongue? Yeah. Okay, perfect. And now with the other cheek, the same. Good. Now let me have a look at your throat again. So, like you're saying that you haven't had any colds, flu, nothing like that lately. Okay. Your chin up a little. nostrils. Okay, let's do a quick test to see if you can actually breathe really well with your nose and there is no nasal congestion or whatever. Yeah, for that you will simply have to close one of your nostrils, right, with your finger and try to breathe in and out. Could you do it once again? Alright, let's do the same kind of test, but I'm gonna use a brush. Okay, in some cases we can use simply a piece of paper, a piece of cotton, really thin one. So what I need to do is to check if the stream of air, the passage of can actually passage through your nostrils really easily, right? In some cases it can be harder to check, but if I see this brush, paper, cotton, whatever sway in the air, then it actually means that everything works just fine and there is no nasal congestion. Does it often happen to you that you have stuffed nose? Runny nose? Anything like that? Gotcha. Got it. No, that's alright. Well, let me have a closer look, okay? So, could you please close one of your nostrils again and in and out. Perfect. Yeah, you could see the brush slightly sway, which means that the air can pass through your nostrils. Now the same with the other one, okay? So please close it. Breathe in and out. Wonderful. Well, it works just fine the way it's supposed to. Good. Now, when it comes to your mouth, throat, like your nose, they are all interrelated. So, in case you have some kind of inflammation, the same about your ears, inflammation in your throat, for example, it can even get to your ears, so you gotta be really, really careful with that. If you feel some kind of symptoms, it's always best to consult the doctor, just not to make it worse and not to have any complications in the future, right? Okay, good. Now, let's test your sense of smell. It's usually quite enjoyable. I have some cotton swabs that I'm about to use, so there we go. And here I have some testers with some scents, smells. They're usually pretty pleasant ones. Okay, so let me put some amount of it onto the cotton swab. Cutie for you. You ready? Okay, just give it a spell. There is no hurry, that's totally fine. So, what do you think it smells like? Vanilla. Right, sure, wonderful. See, it's really hard to confuse it with anything else, right? It's so sweet and recognizable, I would say. Yeah? Now, let me take another cotton swab. Okay. Good. So, you ready? We have all the blisters and the same kinds of bottles. There's no hurry, please. There's no rush. Seriously. Any idea of what that could be? Coffee. Right, yeah. Again, very like standard, recognizable kind of scent. Yeah, I mean, sometimes you might experiment with some rare ones, but since it's just a standard cranial nerve exam, yeah, no worries, there won't be any exotic fruits to recognize. Yeah. Ready? There's no hurry. Again, it's alright. Do you think it is? That would be the last one for today. Citrus. To be more specific, lemon. Right, you are. Good. Okay, so all three, you did really well with them. Yeah, absolutely. I'm so proud of you. Doing great. Now your sense of taste, right? Let's do it. So, I will drop a certain amount of the syrup right onto your tongue. Yeah, so just open your mouth, stick out your tongue. No need to say ah or anything else. You ready? Okay, great. So, what do you think it tastes like? Be your verdict. It's definitely sweet. Yeah. Coconut. Right, sure. Absolutely. Okay, good. Now, let me take another one. You ready? Open your mouth again. Okay. Wow. What do you think this one is? Yep. So you can feel some citrusy notes again. Alright. Oh, it's grapefruit. Right, yeah. sweet, sour, bitter, everything at once. Yeah, it is, absolutely. Okay, wonderful. Good. Well, now, do you have any questions regarding the tests we've been doing? Well, so I suppose that both your sense of smell and taste are totally fine. Congratulations on that. That's really awesome. Good. Okay. Just put all aside really quickly. Okay, fine. Okay, great. So now the next step. I'm gonna take my stethoscope and check if your heart and your lungs work the way it's supposed to. If everything functions alright. Okay? Deal? Good. Alright? So you can lean a little bit closer to me. Will it be a shirt a little? No, just a little. That will do. Okay. Now please press in. And out. Okay, wonderful. Now, so can press in. And out. Okay, amazing. Good. I'll just put my phone aside. Okay. So now press in. And out. Okay, amazing. Once again. And out. Good. I will ask you to hold your breath for a moment, okay? So please inhale, breathe in, and hold there for a moment. And now you can breathe out. Okay, wonderful. Now turn your back, please. Once again, breath in. And out. Good job. And one more time. In. And out. Good. Good. You're doing great. So far. So far, so good, like I said. Okay. Stethoscope. Not gonna need it anymore, at least for now. Okay. Well, like I said, since your heart and your inner organs are related to your vagus nerve, it's a really great way to check if it works just fine. The same regarding your sense of taste. Yeah, so it means that your vagus nerve is just alright. Now, next step, let me check your balance, okay? So that will show me if your auditory nerve at least partially works well. So please, could you straighten both of your arms right in front of you? You can do it. Yeah, absolutely. Now, close your eyes and I will ask you to reach the tip of your nose with your index finger, with your pointing finger. Okay? Good. Yep. That's about right. Wonderful. Now, could you do that with your other hand? The same kind of thing, but keep your eyes closed, please. Okay, great. Now could you stand on your leg for one moment, on one foot I mean? Just stand up. Yes, good. And I want you to raise one of your legs so that you can stand on one foot. Okay? Mm-hmm. And now just switch your feet, switch your legs. Just like that. Okay, perfect. See? It's wonderful. Okay, now I want you to put your hands like that, your arms like that. I will try to press on them to put them down. Don't let me do that. Just try to resist me as much as you possibly can. Okay? I believe you can do that. Right. Yep. So, just relax. That's alright. Good job. Okay, good. Now, I want you to move your head like that, tilted, so that as if you are trying to reach your shoulder with your ear. Yeah? Okay, great. That's right. Exactly. And just put it in that position. Great. Okay. Wonderful. I will try to press it and you resist me and move it back to the straight position. Okay? Let's do it this way. Yeah, that's the whole point. Exactly, good job. Now with the other side. Again, just tilt your head that way. That will do. Perfect. Okay, good. So, do it this way. Okay. Amazing. And again, I will try to press it down and you resist me and move it back to the straight position. Okay, wonderful. Good. Now, could you please frown at me? Now raise your eyebrows. Okay, now smile at me. Could you give me the widest smile possible? That's much better. Okay, now, could you please? Okay, just relax, that's alright. Shrug your shoulders. And I put them up. I will try to put them down and you resist me. You put them up, okay? And let me do that. And let me put them down. Okay, wonderful. Good. And now, okay. Your chin up a little. Try to clench your jaw. I will try to move your lower jaw, your chin down. You resist me. Just keep it clenched, okay? Let's do it. Good. Perfect. Okay. Now, your reflexes. For that, I have a percussion hammer, and we'll start with your knee jerk reflex. So, please, could you sit still and put one knee over the other, one leg over the other, bend them like that, of course. I'll take off those latex gloves. I won't remove them for now. It's too hot. Okay. So, the reflexes. You ready? Okay. Good. Now please switch your legs. Like that. Okay. Good. Perfect. Wonderful. Okay. So, now your wrists, okay? Good. And the other one. Good. Now, let me have a look at your elbows. Okay. Yeah, when I hit right around your tendon, it's supposed to jerk a little, yeah, to make this jerk movement. That's why it's called this way. Yeah, like knee jerk reflex and other kind of reflexes. Okay. Good. Good. Awesome. No, like no worries about that. Good. Just a second. Well, now, I suppose that with your reflexes, we're done. Now your eyes. I'll use my light for that. Please, I will ask you to trace the light, but with your eyes only, okay? Is that doable? Do not move your head, okay? Good. Just relax, that's alright. Good. Doing great. Now please look at my nose and tell me when my fingers, my hands leave your field of vision, okay? Good. But look at my nose, at my face only. We're testing your sight vision, peripheral sight, whatever you call it. And it is really, really important that you do not look at my hands directly, otherwise the results will be inaccurate. Okay? Good. Okay. Good job. Wonderful. That's great. Awesome. Okay, now, again, keep on looking at my nose and tell me when you see my fingers wiggle on either side, or maybe on both. Good. Wonderful. Well, you're doing great. Yeah. Next step. Vision acuity, like I promised. Smell and chart. Let's do it. I'll take this one, if you don't mind. Could you please read the third line for me? I suppose that the first two would be way too easy for you. Wonderful. Now line number 4. Line number 5. Number 6. And finally line number 7. You can do it, come on. Okay, good job. Now, your color vision. Could you please tell me what color you think this is? Good. What about this color? Okay. Okay, and finally this color. You still see it well? Bingo. Amazing. Let me just put them back. And, well, you're definitely not colorblind. So, what can you see here? You might see some shapes, figures, maybe some numbers inside this circle. Okay. Wonderful. What about this one? Okay, well, you're 100% not colorblind. That I can tell you. And finally, your hearing. First, let me have a quick look at your ears with another scope, okay? Okay, now this ear. Perfect. Looks good to me. Now, let me know when you hear the snapping sound. Once again. Now, please try to count how many snapping sounds you've heard. 3. Good. 3 again. And now. And what about now? Good. Well, we're not gonna do some like beep test or full auditory exam tonight, but I will do just a few tests to see if your hearing is actually alright. I will whisper some words, okay? You will let me what you've heard. Deal? Good. Apricot. Okay. Blueberry. Good. Foundation. Research. Breakfast. Perfume. Jewelry. Okay, good. And one more. Grapefruit. Okay, wonderful. That's great. Good. Your hearing is totally fine. Well, I also have a tuning fork, but I actually have a few of them. But I guess that we'll leave them till next time when we have a really thorough ear exam. Okay? Yeah, it's not obligatory to use them tonight. Well, what can I say? We have checked all of your cranial nerves. I have checked your eye movements, your peripheral sight, your vision acuity, and if you're colorblind or not. So the results are really, really great. Then, when it comes to your hearing, we have also checked how well you can hear. We have checked your balance, your vestibular apparatus, how it works, which means that your vestibulocochlear nerve, or simply auditory nerve, works just fine as well. Then, your sense of smell and taste, they're very, very precise. They're functioning the way they're supposed to. So I can suppose that all of your nerves like olfactory, facial, vagus, glossopharyngeal, they are just fine. The same regarding your hypoglossal nerve, so you can move your tongue, you can swallow just right. So I haven't noticed any issues with that. Then your reflexes are on point to you. I have used my stethoscope to check your lungs, your heart, how they work, listen to your breathing, and you don't have any kind of nasal congestion either, so that's really good. There are any residual cough or something from the previous colds, which is like really, really great. Okay. Now, well, all the rest. Basically, we have done everything we were supposed to. That is super accurate, super detailed and thorough cranial nerve examination. You are absolutely healthy, and it was actual pleasure to have this session with you. I wish all our patients were as thorough and as punctual as you are. And it's also really great that you take good care of your health, that you take it seriously. Yeah, absolutely. That's right. Exactly. Well, I'll see you soon then.